Hi, I'm Dr. Stephanie Sheen, Chief Veterinary Officer at Petspan, and today I'm going to talk about and demonstrate how to administer liquid medications to cats. Now, before you get started, there's a few things that you may want to have on hand and have ready that could make medicating a little bit easier. One of those is a nice thick towel, which we'll use to do a little wrap around our cat. Another one is Feel-Away. This Feel-Away spray is a feline pheromone, which can be calming, and this is something that you can spray onto the towel and let that sit about 15 minutes before you get started, and that can help calm your kitty a little bit as well. You may want to have some tasty treats available. So these ones are by Nulo. It's a little puree, but Churu makes something similar. If your cat likes a little bit of whipped cream or a little bit of peanut butter or even canned cat food, that might be nice to have out and available to use as you go through this process. So we'll talk about the medications. This is how they're going to look when they come to you. And they come with a few different syringes. These are all 1 cc or 1 milliliter syringes. And you're going to have your little bottle of medication here. Now it says to shake well before you give it. So before you draw it up, you want to give it a good shake. And then on the prescription label, it's going to have how much to give your cat specifically based on their weight. So most kitties are going to be between 0.25 and 1 milliliter of medication. And so this is the syringe here, and it will allow you to get that nice accurate dosing. Now, when we're dosing with this syringe, we're going to measure that from the top of this plunger. So where you see the top of that black mark, it's going to line up with the little slashes here on the syringe, which will allow you to make sure you're giving the right amount. So a 0.25 would look like that, about a quarter of the syringe. A 0.5 would be halfway down there, and so on. So you want to make sure that when you're opening this, and then you can just take that top off, it's going to have a little hole there on the top, which will allow you to put the syringe in. So you're going to stick that in the top nice and tight, and then you can flip it over, and that will allow you to get the right amount of medication. So you can go a little past the point where you want the medication to eventually end up at. So if there's any air bubbles that get in there, you can just push them out, and then you push right up to where you want to be. So this would be a 0.5 dosing here. All right, so we're here with our volunteer Nico, and we've got some of that Nulo puree that I talked about on this little licky mat, which he's loving. I've got my towel out, so we're ready to give this a try. So there's a couple different ways that you can do this. If your kitty's pretty good with medicating, you can simply put them between your legs with their head facing away from you and administer the medication without having to do a wrap. But I'm going to show you what that wrap looks like because it gives you a little bit more control, kind of takes away the claws part of the equation so that you don't get injured. That was quick. You can also put a little bit of this treat on top of the syringe. This is just water, and we're going to practice, and you can do this at home too if you're not sure if your cat's going to do well with medicating and you want to give it a practice go first. You can just fill the syringe with water to give that a go. Nico really likes this Nulo treat, so that's going to make it really nice and easy for us once we get started. He says yummy. All right, go get a little bit more of that in a minute. So I'm going to have him facing away from me on this towel, and the important part here, I know it's there on the syringe, the important part here is to have a little bit of space that you can work with in the front because we're going to do a little bit of a scarf. So I'm going to set that to the side because that smells really tasty, and I'm going to bring this up and then kind of twist it around to make a little bit of a scarf around the front of him. So this allows me a little bit more control, and you can even put this all the way around to make a little burrito, but this should be enough for us to be able to medicate him. So he's saying, I want to get away, but that's okay because we're nice and wrapped. And so he's gonna love that little bit of treat on there, and I'm just gonna give that medication right into the back of his mouth. And the treat helps a lot, huh? So that's it. You want to make sure it's a really positive experience, so don't be shy to use a little bit of treats. You can see how much he likes that. And so that means when we get the towel out, he won't be too nervous about that in the future. You see he's not struggling to get out anymore. He says, this is pretty nice here. I get some tasty treats. So we're going to double reinforce that with just a little bit of extra. The main parts of giving the medication that you want to be aware of is you want to kind of shoot it back towards the back of the throat a little bit, so that kind of come here in the side of the mouth and squirt it to the back of the throat. And that will allow us to make sure it gets back in there. So even if they do a little bit of tongue movement and try to push it out of their mouth, they won't be as likely to be able to do that. What a good boy. And if your cat does start to anticipate that the towel coming out means that he's going to get medicated and he doesn't like that, then you can start to use things like these licky mats, or even feed canned food or regular meals on this towel to start to desensitize them, so that when the towel comes out, usually means I'm going to get a treat of some kind, even if I do get a little bit of medication in between.